Welcome back. Before we wrap, let's get to some questions and comments sent in by you. Joe wrote to us with this: I'm 77, I had triple bypass surgery. I've been afraid to have sex. I still get winded after short walks around the block. My doctor says I'm recovering well and I need to lower my expectations for intimacy. What can I do?
What a difficult spot. So I guess this comes down to symptoms of breathlessness and the worry that maybe if you engage in intimacy or vigorous exercise, you may put yourself at risk, or you just can't keep up. And the truth is, shortness of breath when doing exercise, whether that's sex or anything else, can have one of many causes, only one of which can be heart artery disease. Bypass surgery treats blockages in heart arteries, but there are a lot of other issues that can happen with the heart, with the lungs, and with the rest of the metabolic systems in the body that can give rise to a symptom like shortness of breath. I think it's probably reasonable to continue investigating that, to make sure that you really do turn over the stones, because your participation in intimacy is so important to your quality of life, before throwing your hands up, so to speak, and saying, I accept that I have to lower my expectations. That'll begin with a good consultation with a cardiologist after you've had the bypass surgery, to make sure that everything that could be fixed from a heart artery perspective was fixed, and that your heart pumping function and your body's fluid balance are in the place they should be to optimize your ability to function. Beyond that, you check the heart's electrical system, you check the heart's rhythm, you check how well the lungs are functioning, and a number of different blood tests to make sure that the rest of the body systems are where they should be. And more often than not, with the right medical therapy and cardiac rehab, so supervised return to activity, people's symptoms really improve, their exercise capacity improves, and engaging in intimacy or even regular exercise is absolutely achievable.
And good advice, and certainly important for anyone to know. Alan writes this: I have heard that beta blockers and diuretics can cause erectile dysfunction. However, those drugs are important for heart-related issues. What medications won't affect my sex life?
Well, I mean, you have to choose your battles. If those are the medications that are keeping your heart healthy enough to function and live a healthy life, then you may have to work with those within those medications and try to treat your erectile dysfunction in other ways. Mm-hmm.
You know, there's a lot of medications that get left around, right? So if you really need a medication to optimize your heart health, then you've got a tough choice ahead of you. But many times with diuretics, I mean, there's not a huge effect on erectile function, to be honest, but beta blockers is a common culprit. We use beta blockers in patients who have angina, right? So who get chest pain with activity, but there are alternatives that can be used to reduce chest discomfort and give you quality of life. In patients who have poor heart pump function below a certain severity, beta blockers are part of the mainstay of therapy. But the upside is that most patients get used to the effect of the beta blocker, and their erectile dysfunction as a result of that piece can be managed, either with additional sort of adjunctive therapies, pumps, etc., or by changing the beta blocker to a different choice of medication. I do agree that, you know, you need your heart health to really have the backbone of therapy that's necessary to keep you well. But generally speaking, through collaborative relationships with other physicians, we can get people to a quality of life that they're satisfied with, either on those medications or on alternatives.
One point I would just make is, staying on your medications as prescribed is really important. And a lot of men may stop taking really important heart medications because they're getting a side effect, such as erectile dysfunction. So again, it's really important to be able to bring this up with your doctor, because there may be an alternative medication that won't have the same side effects, or we can just give you something else to improve your erections. But don't just give up the medicine because you're potentially harming yourself.
All right, before we go, as we always do at the end of each show, is we get final thoughts from each of you. So we'll start here.
Final thoughts? Well, see your doctor. If you have ED, see your doctor, because it may save your life,
Cardiovascular health in men is neglected when we're young. The time to treat cardiovascular disease is not after it's occurred. It's to prevent it by taking care of yourself when you're young, so that you retain your quality and quantity of life as you get older. See your doctor regularly. That's your best weapon.
Men's health is becoming its own unique field. Why? Because there's a need. Men are not living as long. They have worse health outcomes. And I think, as we've all discussed here today, a lot of reasons will bring men into the office, whether it's erectile dysfunction, urinary prostate issues, or other issues. But just don't ignore these symptoms because, again, prevention is the key.
And I'll say to the guys, you don't have to do it alone. There's a lot of people out there that we want to help, and just try to get the help, and so you don't have to go alone.
All right, we'll have to leave it there. And before we wrap, a thought: by taking charge of your health today, you're setting the stage for a dynamic and fulfilling tomorrow. Here's to thriving in our Zoomer years. And with that, it's a wrap for tonight. Connect with us at comments@thezoomer.com. Huge thanks to our panel, to all of you at home. For now, it's time to zoom out.